Welcome to Chatterbox Podcast. I'm John.
And I'm Jessica. This time we're looking into a profession that most folks don't really think about all that much, dentistry. And we've got a fascinating excerpt here all about Gülce,
Okay.
this incredible, successful dentist, and her story is just full of twists and turns you wouldn't expect.
I mean, talk about a transformation. That's pretty amazing. I have to say that what I find really fascinating about her story is how personal dentistry can be.
Right.
You know, it's more than just those drills and fillings everybody thinks about.
Yeah.
It's really about connecting with people, understanding their anxieties, and helping them feel good about themselves, not just, their oral health.
Exactly. And her story starts in a pretty unexpected place, too.
Oh, really?
Yeah, imagine being 3 years old, arriving in a brand new country.
Wow.
The United States, and your very first experience at an American dentist's office is pure terror.
Oh, my gosh.
That's exactly what happened to Gülce, who emigrated from Turkey.
That's intense. I mean, it makes you think about how resilient kids can be,
Yeah.
to overcome that kind of initial fear and then turn it into a lifelong passion. I mean, that really speaks volumes about her character.
It really does, and you can see that determination throughout her entire journey. I mean, she studied biological sciences in college.
Makes sense.
Which makes total sense given how much science is involved in dentistry. But then comes the real test. 4 years of intense dental school.
Oh, yeah.
I mean, it's not just about memorizing facts, right? It's
Yeah.
about understanding all those complexities of the mouth and then mastering these intricate procedures.
Absolutely. And the excerpt actually really emphasizes those demands of dental school.
Yeah.
It mentions Gülce sweating profusely during her very first composite filling procedure,
Oh, wow.
with her professor scrutinizing her every move.
Oh, geez.
Talk about pressure.
Oh, I bet. But what's so interesting is that moment, that feeling of successfully repairing a cavity and seeing the patient's relieved smile, that's when it clicked for her.
Oh, wow.
It's like all that hard work suddenly had a purpose,
Yeah, absolutely. That sense of fulfillment and helping others, especially in such a tangible way. It really resonates throughout Gülce's whole story.
And she didn't just stop at being a general dentist either. After graduating and acing the notoriously difficult National Board dental examination, she went on to specialize in prosthodontics.
Okay, so imagine this. Instead of simply filling cavities, you're rebuilding someone's entire mouth,
Wow.
tooth by tooth, using all these techniques and technologies to create restorations like crowns, bridges, and veneers.
Oh, wow.
That's prosthodontics. It requires a whole other level of expertise.
That's incredible. And this expertise allowed her to have just a huge impact on people's lives.
I bet.
The excerpt talks about one patient in particular
Okay.
who had severe enamel erosion from years of eating acidic foods and also teeth grinding.
Well,
He could barely eat. And Gülce used her skills to design a full mouth reconstruction with ceramic crowns,
wow.
essentially giving him a brand new set of teeth.
Oh, that's amazing.
That must have been so life-changing for him.
Absolutely. And it shows how dentistry goes beyond just fixing teeth.
Yeah, right.
It's about improving someone's quality of life on so many different levels. Their
Yeah.
ability to eat, their confidence, their overall health.
Right, but hold on, because there's even more to Gülce's story. She didn't just become this amazing prosthodontist. She also decided to open her own clinic in New York.
Wow. That's a whole other level of ambition and dedication right there.
I know, right?
Like you're not just a dentist anymore, you're running a business, managing finances, hiring staff, staying up to date on the latest technologies.
And speaking of technology, the excerpt mentions how dentistry has really embraced some fascinating advancements. Things like digital impressions,
Oh, yeah.
which I bet are way more comfortable than those gooey molds.
Oh, for sure.
And laser dentistry, which is used for treating gum disease. It's amazing how much the field has changed.
It really is.
Yeah.
And for someone like Gülce who thrives on challenge and growth, this constant evolution must be so exciting.
Yeah.
It allows her to provide her patients with the most cutting-edge care.
And this is where it gets really interesting. Gülce has this quote in the excerpt that says, one of the biggest misconceptions is that dentistry is just about fixing teeth. She emphasizes how it's so much more than that. Function, aesthetics, and overall health are all connected.
That's such a critical point.
Yeah.
We tend to separate dental care from the rest of our health, but the truth is, it's all interconnected.
Yeah.
She even mentions how neglecting oral hygiene can be linked to serious conditions like heart disease and diabetes.
Wow, I didn't realize the connection was that strong.
Well, yeah.
It makes you think twice about skipping that next dentist appointment, right?
Absolutely. And I think that's where Gülce's personal story comes full circle. Remember that terrified little girl who first stepped into an American dentist's office? Well, she's now a successful immigrant, running her own practice, treating patients of all ages, and helping them find not only healthier smiles, but also a renewed sense of confidence.
It really is an inspiring story.
It is.
And it highlights something we often take for granted, the power of a smile.
Absolutely.
Like when you think about it, it really is amazing how Gülce's story brings together so many different aspects of life.
Oh, it is. It really is. And that's kind of what makes her journey so compelling, I think. It touches upon the immigrant experience, highlights the business side of healthcare, showcases the impact of technology, and ultimately it kind of reminds us of the importance of human connection, all within the context of dentistry, you know.
It really makes you wonder how many other fascinating stories are hidden within these seemingly ordinary professions, right?
Absolutely. I mean, and speaking of hidden stories, Gülce's experience as an immigrant is something that really resonates with me. Think about it, coming to a new country at such a young age, facing those initial anxieties and cultural differences, and then ultimately thriving in a field that requires such a high level of skill and precision.
It's a powerful reminder that success can come from the most unexpected places.
Oh, yeah.
And it makes you think about the unique perspectives and insights that immigrants bring to their professions.
Exactly.
Yeah.
Imagine the impact Gülce has on her patients, especially those from similar cultural backgrounds.
Yeah.
That sense of shared understanding and trust can be so crucial in a healthcare setting.
It's like that feeling of being seen and heard, you know.
Right.
Which can make all the difference in the world.
Absolutely.
But let's shift gears for a moment and talk about the business side of things.
Okay.
Opening her own clinic in New York.
Yeah.
That must have been a whole other challenge.
Definitely. It's easy to romanticize the idea of being your own boss. But Gülce's story shows that it takes a tremendous amount of work and dedication. You're not just a dentist anymore. You're an entrepreneur, a manager, a financial planner. It's a constant juggling act.
And it's not just about managing those day-to-day operations either.
Right.
The excerpt mentions how Gülce had to stay ahead of the curve when it came to advancements in dental technology.
Oh, that's a great point.
Right.
Digital impressions, laser dentistry. I mean, these technologies are transforming the field.
Yeah.
They offer more precise and less invasive treatments. But for clinic owner, it also means investing in new equipment training staff and educating patients about the benefits.
It's like this constant cycle of learning and adaptation, and it makes you wonder, how do these advancements impact the accessibility and affordability of dental care?
That's a crucial question. While these technologies offer incredible potential, we have to be mindful of the potential for disparities.
Yeah.
You know?
Yeah.
Do they primarily benefit those who can afford them, or are they becoming more accessible to everyone?
Right.
These are important considerations as technology continues to evolve.
It's like that double-edged sword we talked about earlier. Progress is great, but we need to make sure it benefits everyone, not just a select few.
Exactly.
And speaking of access and equity, Gülce's quote about dentistry being more than just fixing teeth really struck a chord with me.
Me too. It's such a simple statement, but it really reframes our entire understanding of oral health.
Yeah.
She highlights the connection between oral hygiene and overall well-being, even linking it to serious conditions like heart disease and diabetes.
It's like a wake-up call reminding us that our mouths are not separate from the rest of our bodies.
Right.
And it makes you think, how many other health issues are we overlooking because we're not making those connections?
That's where education and awareness become so important, you know? We need to move beyond just telling people to brush and floss.
Right.
We need to help them understand the why behind those recommendations.
It's about empowering people to take control of their health, and Gülce's story is a perfect example of that. Think about it. She took her own fear of dentistry and turned it into a passion for helping others overcome their anxieties and achieve healthier, more confident smiles.
It's a beautiful reminder that even in a field as technically demanding as dentistry, compassion and human connection can make all the difference.
Yeah.
And it makes you wonder.
It makes you wonder how much of a role empathy plays in other healthcare professions.
It's essential. You know, building trust, alleviating fears. You know, those elements can really transform a patient's experience, especially in dentistry, where so many people carry those childhood anxieties.
Yeah.
Gülce's ability to connect with her patients on that level, it's pretty remarkable.
It really is. She turned a childhood fear into a tool to help others.
I know, it's amazing.
But going back to those technological advancements we touched on earlier, I'm curious about the accessibility of those innovations. Like, are they available to everyone, or are they primarily benefiting those who can afford them?
Yeah, that's an important question to consider. Uh, these advancements hold incredible potential for improving oral health, but we have to make sure they don't widen existing disparities.
Right.
It's not enough to just celebrate progress.
Right.
We also need to be mindful of equitable access for everyone.
It's like a balancing act, embracing innovation while ensuring it benefits all segments of society.
Absolutely.
And since we're on the topic of equity, we talked about how neglecting oral hygiene can impact overall health. But how do we effectively get that message across? It's one thing to know the facts, but it's another to actually change behavior.
Right. Knowledge doesn't always translate into action. Maybe we need to reframe the conversation around oral health,
Okay.
Instead of focusing on fear or shame, let's highlight the positive aspects.
Yeah.
A healthy smile can boost your confidence, improve social interactions, and even have a positive impact on your professional life.
I like that shifting the focus from dental hygiene as a chore to taking care of your smile as an investment in yourself.
Yeah, exactly.
It's a more empowering message. And maybe that's one of the most important takeaways from Gülce's story, that our smiles are more than just a physical attribute. They reflect our overall well-being inside and out.
Exactly. A healthy smile can have a ripple effect.
Yeah.
Spreading positivity and a sense of empowerment, just like Gülce helps her patients achieve.
It's a powerful reminder that we all have the potential to make a difference no matter what path we choose in life. And sometimes that difference can start with something as simple as a smile.
A smile that reflects not just healthy teeth, but a confident and healthy individual ready to take on the world.
Well said. So you guys wanted to know more about the world of a registered nurse, an RN.
Right, and you pointed us to this really powerful article titled Unsung Hero, Episode 2, The Registered Nurse Chimp.
Yeah, and this isn't just like a dry, boring textbook definition of what an RN does. This is actually, well, it's a story.
Yeah.
It's the story of Valeria. And she's really pretty amazing. Came to the U.S. from Colombia and just had this fire in her to become an RN.
Yeah, it's really inspiring.
It is. It is. So our goal today is actually pretty straightforward. Through Valeria's experience, we want to kind of unpack what it really takes to become an RN in the United States, what you actually do on the job every day, what it's like, and the dedication it takes. I mean, you really get a sense of that from this article.
Oh, absolutely. And I think Valeria's story is especially powerful because, just imagine, she came to the U.S. when she was only 12 years old.
Wow.
Had to learn a whole new language.
Yeah.
That adds another whole layer of complexity to her achievements, especially in such a demanding field.
Oh, for sure. And even from her early childhood, she just had this deep desire to help people, really make a difference in the world. And, that kind of drive that really fuels you through so much.
It really does. And it's interesting, the article actually mentions this, saying that her mother always told her, El que persevera alcanza. It means he who perseveres achieves.
I love that.
Yeah, and it really speaks to that foundation she had, that support, that determination that was instilled in her from a young age. And that kind of encouragement, you don't always see it, but it can be so critical to someone's success.
Absolutely. Okay, so she has this dream, this powerful dream. What's the first big step, on the road to becoming an RN?
Well, typically the first major hurdle is getting a Bachelor of Science in nursing. It's you usually see it as a BSN.
Okay, a BSN.
Yeah. And it's, it's a pretty serious commitment. It's usually a 4-year program at a college or a university, and it's really designed to give you that solid foundation you need for patient care.
Makes sense.
It's a lot of hands-on training, but also, a really significant chunk of it is theoretical knowledge.
Gotcha. And this is where things get, academically pretty tough, right? I mean, the article mentions some pretty intense coursework.
Oh, yeah. There are 2 big ones that they highlight.
Yeah.
Pathophysiology and pharmacology.
Okay, break those down for me. I'm not a science person.
All right, so pathophysiology, it's basically understanding how different diseases mess with the normal functions of the body. So the mechanisms behind what causes the symptoms, how the illness progresses. You can kind of think of it like being a detective for the body.
Okay.
Figuring out how the disease is messing with the normal crime scene inside.
Interesting.
Yeah, so it's not just about identifying the disease, it's about understanding all those cascading effect it has within the body.
That is intense. Okay, so that's one. What about the other one? Pharmacology.
Right. So pharmacology, well, that's all about medications. It's the science of how drugs work. So nurses need to know how different drugs work, their side effects, how they might interact with other medications. It's a huge responsibility, making sure you're administering those meds safely and effectively.
Right.
It's like having a toolbox full of all these different medicines, and you need to know exactly which tool to use, and how much to use to get the best results.
Wow. Okay. So heavy dose of science. But it's not all just, sitting in a classroom, is it?
Definitely not.
The article really emphasizes these clinical rotations as being super crucial and pretty demanding.
Oh, yeah, absolutely. Clinical rotations are where you take all that knowledge and you actually get to apply it.
Okay.
So nursing students, they get to work in real healthcare settings like hospitals, clinics, all under the guidance of experienced nurses, of course. It's their chance to put everything they've learned in lectures into practice, work with real patients, really helps build those practical skills and gain confidence.
Yeah, that makes sense. But it's got to be a little, I don't know, intimidating at first, right?
Oh, of course.
You're still learning, and then you're interacting with actual patients. I mean, Valeria's experience with her first intramuscular injection, that really brings that to life.
Yeah, it does. Giving an IM injection, shot it into the muscle, it might seem pretty routine, but when you're a student and it's your first time, yeah, there's a lot of pressure to get it right.
I can imagine.
You want to do it safely, correctly.
Mm-hmm.
So her nervousness, it's completely understandable. And it's great that the article talked about how supportive her instructor was in that moment. That's so important, having that mentorship, that reassuring presence when you're taking those first steps.
For sure. Okay, so she's made it through the BSN program, all the tough classes, those nerve-wracking clinicals. What's the next big hurdle, to officially becoming a registered nurse?
That would be the NCLEX RN exam. It stands for the National Council Licensure Examination for Registered Nurses.
Okay.
It's a big one. It's this standardized test that every single aspiring RN in the U.S. has to pass.
Got it.
And it's designed to make sure they have the knowledge and the skills to practice safely.
Right, that makes sense.
Right.
So the article mentions Valeria's studied for 3 months straight for this exam.
Yeah.
That really gives you a sense of how big of a deal it is, beyond just, the sheer amount of information you have to know. What are some of the things that trip people up on this exam?
Yeah.
What keeps otherwise knowledgeable people from passing?
That's a good question. I mean, obviously, you need a really strong understanding of nursing principles.
Yeah.
But the NCLEX, it goes beyond that.
Okay.
It really tests your critical thinking skills, your ability to take that knowledge and apply it to all these different patient care scenarios. And then, of course, you have test anxiety. That gets to a lot of people. And sometimes it's just about, misinterpreting the questions themselves.
Makes sense.
Valeria actually talked about how she really focused on drug interactions, which is critical because, if you give a patient medications that interact badly, that can have really serious consequences. She also drilled down on patient safety protocols, all the procedures that are in place to prevent medical errors and ensure, the best outcomes for the patient.
Right. And she even studied how to recognize the early signs of sepsis, which sounds incredibly important.
Oh, it is.
And also quite advanced. To be honest, I had no idea nurses needed to be that tuned into that kind of thing.
Oh, yeah.
That's high stakes.
It is. Sepsis is incredibly dangerous. It's basically when the body has this overwhelming response to an infection, and it can be life-threatening. If you can catch it early, it can make all the difference.
Wow.
So recognizing those early signs is crucial. And that's really what the NCLEX is all about. They want to know, can you make those critical judgments under pressure?
Yeah, absolutely. Well, thankfully, Valeria passed on her first try.
Yes, she did.
Which must have been a huge relief after all that prep.
I can only imagine. Passing the NCLEX, it's a huge accomplishment. It's like, the official gateway to practicing as a registered nurse.
Yeah.
But in the article, Valeria actually says something really interesting. She says that getting that license, that was really just the beginning of her learning journey.
I love that. Okay, so she's got her license. Where does she actually start her career?
So her first job was in a medical surgical unit, which is often just called med-surg. It's a really common starting point for new RNs. Med-surg units, they deal with a wide variety of patients. People recovering from surgery, people with different illnesses that aren't critical but still need care. It's a fast-paced environment. You're often juggling multiple patients with all sorts of different needs.
Yeah. And the article actually, it highlights the challenge of managing so many patients at once and the importance of charting.
Right.
Can you talk about that a bit? I mean, what kind of things are crucial to document, and why can't nurses just, rely on their memory?
That's a really important point. Charting or documentation, it's the backbone of nursing. You have to record everything that's relevant to a patient's condition, their symptoms, vital signs, meds you give them, any treatments, how they're responding, any changes you notice. It's basically creating this detailed record of their healthcare journey during your shift. And that's super important for communication. Everyone on the healthcare team needs to be on the same page. You need that consistency across shifts, across different providers. Plus, it also serves as a legal record. Trying to remember everything in such a busy, complex environment, it's too risky. It could really impact patient safety.
Makes sense. Sounds like you have to be super organized and really detail-oriented.
Definitely.
Then the article talks about this incident where a patient's vitals just crashed.
Yeah.
That must have been terrifying, especially for a new nurse.
Oh, absolutely. It really shows you how high-pressure nursing can be. When a patient's vital signs, things like their blood pressure, heart rate, oxygen levels, when those suddenly drop, it's a major red flag. It means their life is in immediate danger. So what Valeria did, it's textbook. She immediately called a code blue, which gets a rapid response team to the patient right away. And she started basic life support. In those moments, you have to think fast and act decisively. The fact that she stayed calm in that kind of situation, it really shows how much she'd grown as a nurse, her resilience.
Yeah, for sure. So after all that experience in the med-surg unit, Valeria decided to specialize in critical care nursing, working in the ICU.
Yes.
Which sounds like a huge step up in terms of, how complex the cases are.
It is. The ICU, the intensive care unit, that's where the most critically ill patients go, the ones who need the most intensive care.
Right.
And the conditions they're dealing with, they're often way more complex, multiple organ failures, things like that.
Yeah.
They need advanced life support.
Yeah.
It's a whole other level.
The article mentions some pretty specific technical skills that are needed in the ICU. Things like managing ventilators and titrating medication drips. Can you unpack those for me? Especially titrating medication drips. That sounds incredibly precise.
So a ventilator, first of all, it's a machine that basically helps a patient breathe when they can't do it on their own.
Okay.
Managing a ventilator, that means you need to understand all the different settings, monitor how the patient's responding, and make adjustments based on their condition. It's a lot.
Yeah.
And titrating medication drips, that's basically adjusting the rate at which certain medications are delivered intravenously. You have to be super precise with this because a lot of critical care drugs, they have to be given within a very specific range to be effective but not harmful.
Gotcha.
It's kind of like, carefully adjusting the flow of life-saving medicine drop by drop.
Wow.
It takes a deep understanding of both pharmacology and physiology.
And, beyond the technical stuff, I imagine the emotional weight of working in the ICU must be immense. You're constantly dealing with people who are so sick and their families who are going through so much.
You're absolutely right. Critical care nurses, they need more than just technical expertise. They need emotional resilience.
Yeah.
And they need empathy. You're often the main point of contact for the families. You're supporting them through these incredibly stressful, uncertain times. You're providing comfort, information, just a compassionate presence.
That's so important. Now, the article also mentions the need to interpret EKGs. So what kind of information do those give you about a patient's condition?
So an EKG, that's a recording of the heart's electrical activity.
Okay.
And by looking at the patterns of those electrical signals, nurses and doctors can identify all sorts of heart conditions. Things like arrhythmias, which are irregular heart rhythms, signs of a heart attack, other abnormalities that can be really serious. Being able to read those EKGs quickly and accurately, that's essential in critical care. You need to be able to spot those problems and intervene quickly.
That's amazing. It's clear that critical care nursing, it requires such a specialized skill set and honestly, a lot of inner strength too. It's pretty incredible that Valeria transitioned into such a demanding field.
It really speaks to her dedication, her commitment to always learning and growing professionally, and of course, her passion for taking care of patients.
Yeah.
But her journey didn't stop there. The article goes on to talk about how she's now a mentor to new nurses, and she's also advocating for better healthcare access in underserved communities.
It's like her story has come full circle, in a way. I mean, she's not just providing that direct critical care anymore. She's investing in the future of nursing, and she's working to address these larger issues in healthcare.
Exactly. And she sums it up perfectly when she says, it's not just a job, it's who I am. And that really captures that sense of purpose, that deep sense of identity that so many nurses have. The fact that she finds so much fulfillment in being there for people during their most vulnerable times, it's a powerful reminder of that human connection that lies at the heart of nursing.
Absolutely. Okay, so just to kind of recap Valeria's incredible journey for everyone, it starts with her immigrating to the U.S. as a kid, this really powerful childhood dream of helping others, and all of that was nurtured by her mother's encouraging words.
Nice.
Then she makes it through this rigorous 4-year BSM program, tackling all these challenging courses like pathophysiology and pharmacology, building those crucial real-world skills in clinical rotations, even overcomes those first-time jitters of giving her first injection.
Right, and then after graduating, she faces down the MCLE-XRN exam, studying like crazy, focusing on things like drug interactions and those early warning signs of sepsis, and she passes on the first try.
Amazing. Then she starts her career in a really busy medical surgical unit where she gets even more experience, learns how to manage all these different types of patients, masters that crucial charting process, and even keeps her cool during a patient emergency.
All of that leads her to specialize in critical care nursing in the ICU. She learns how to manage ventilators, how to titrate medications with absolute precision, how to read those vital EKGs. And now she's not just a highly skilled critical care nurse, she's also a mentor and an advocate. It's really inspiring.
It is. It's a career path that demands so much. Technical knowledge, critical thinking, resilience, empathy. Valeria's story really shows just how much dedication and perseverance it takes to not only become an RN, but to really thrive in that profession.
Yeah, it really highlights the fact that for people like Valeria, nursing is so much more than just a job. It's a true calling. It's about being present, giving expert care, and making a real difference in people's lives, especially when they're at their most vulnerable. That sense of fulfillment, that's her aha moment.
100%. So this deep dive into Valeria's journey to becoming an RN, it actually raises a pretty thought-provoking question for all of you. You know, we've seen the incredible dedication, the diverse skills that are needed for this profession. What other unsung professions are out there? You know, the ones that are just as critical, just as demanding, but we often don't even think about.
Right, exactly. Think about all the hidden effort, the specialized knowledge that goes into all those essential services that we rely on every day.
Yeah.
We're exploring the world of chiropractic care.
All right.
But there's a bit of a twist to this one. We'll be looking at it through the unique perspective of Junho. He's a practitioner whose story, well, it might just make you rethink what chiropractic is all about.
Yeah, fascinating guy.
We've got a lot to unpack today. Junho's personal journey, how someone actually becomes a chiropractor, and even how he blends Eastern and Western practices. It's going to be a fascinating deep dive.
Absolutely. Where should we start?
Well, I think the best place to start is at the beginning. Junho's story starts in Seoul, South Korea.
Oh, interesting.
Yeah, picture this. Young Junho in his grandmother's traditional Korean medicine clinic. She was a Hanui, essentially a traditional healer.
Oh, wow.
And he'd watch her use these hands-on techniques to help people relieve their pain. And seeing that, I mean, it really planted a seed for his future.
You know, makes you wonder what we pick up as kids and how it affects us later on, huh?
It really does. But anyway, fast forward a bit. Junho moves to the U.S. at 18. Now imagine coming to a new country, trying to learn a new language.
That's a challenge in itself.
Oh, absolutely. But then, on top of that, he's diving into the world of complex medical terminology.
Oh, talk about a steep learning curve.
Seriously. He actually tells this really funny story about his first anatomy class. The term cervical spine completely threw him off.
Really?
He thought it was some rare disease. Just goes to show clear communication is so important, especially in healthcare.
100%. You should never be afraid to ask your doctor or practitioner to clarify something you don't understand.
Right. Now, thinking about chiropractic care, it does get, a bit of a bad reputation sometimes.
No.
Some people think it's all about cracking bones. Like, that's it.
Hmm.
So what's the truth? What would you say to someone who's a little skeptical?
Well, I think the biggest thing to understand is that chiropractic care is really rooted in biomechanics. You know, how our bodies actually move. Every twist, every bend, every time you lift something, it affects your spine. And chiropractors, they go through years of rigorous training. They're studying anatomy, physiology, the nervous system.
So it's a lot more than just, treating back pain then.
Right. It's about getting that nervous system to function properly, which impacts, well, so many things, from how we feel pain to how our organs work. Junho's story really drives that point home. It's a holistic approach.
Yeah, and speaking of adjustments, Junho talks about this term subluxation, particularly when he worked with athletes.
Ah, yes, subluxations.
Can you break that down for us? What is it, and how does it fit into this whole picture?
Absolutely. Okay, so think about that nagging ache in your neck or that stiffness in your lower back. Those could actually be signs of a subluxation. Basically, it's when your spine is misaligned. And even a tiny misalignment can cause big problems. It can mess with your nerve flow, leading to pain, restricted movement, all sorts of things. Junho actually had this patient, a football player, who was dealing with horrible lower back pain.
I bet.
Turns out his lumbar vertebrae, those are the bones in your lower back, they were out of whack, putting pressure on the nerves.
Ouch.
Yeah, but with careful spinal manipulation, Junho was able to get those vertebrae back in line and really help alleviate that pain.
It's kind of crazy how interconnected everything is in our bodies, right?
It really is.
And this is where Junho's story gets even more interesting. He actually brings Eastern healing practices into his work, like acupressure.
Yeah, it's becoming more common now
Right.
as healthcare shifts toward a more integrative approach.
I see.
Acupressure works on those energy pathways in the body, much like acupuncture, to release tension, promote healing. So Junho, by combining this with chiropractic adjustments, he's addressing both the physical and the energetic aspects of well-being.
It's really fascinating how he's blending these approaches.
Yeah.
And I think it speaks to this idea that, our bodies have this incredible ability to heal.
Absolutely. Our bodies want to be in balance.
We just need to give them the right support.
Exactly. So thinking about all this, what stands out to you most about Junho's story?
I think for me, it's this powerful reminder that healthcare, it's deeply personal. It's not just about what's in the textbooks. It's about understanding the individual, their needs, their experiences. And Junho's journey from that traditional Korean clinic to this blend of Eastern and Western practices, it really makes you think outside the box.
Yeah, for sure.
It makes you wonder what other traditional healing methods are out there. What else can we learn from? I think that's a pretty awesome thing to think about.
Absolutely. There's so much knowledge out there just waiting to be rediscovered.
That's a great point to end on. Thanks for joining me for this deep dive.
My pleasure. Always a fascinating discussion.
And to our listeners, we'll see you next time for another deep dive into the world of, well, who knows? That's the fun part. See you then.
Until next time.